Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of what's happening in the healthcare world. I'm Stephen Newmark, Chief Policy Officer at the Global Healthy Living Foundation. And this week, I'm recording from London, where I'm attending one of the world's largest rheumatology conferences, EULAR, the European Alliance of Associations for Rheumatology. Now, if you're not in medicine or research, you might hear the word conference and picture doctors sitting through endless PowerPoint presentations and drinking too much coffee. And yes, there is definitely some of that going on here, but conferences like EULAR are actually incredibly important for patients, because this is where new science gets unveiled, researchers and clinicians exchange ideas, pharmaceutical companies present emerging therapies, and patient voices increasingly shape the future of care. And for organizations like GHLF, these meetings are not just about networking. They are about making sure the patient perspective is present in rooms where important healthcare decisions and innovations are taking shape. So today, I want to pull back the curtain a little bit and explain what actually happens at conferences like EULAR, why they matter for patients, and some of the major themes already emerging this year, including artificial intelligence and the growing excitement around CAR T and cell therapies for autoimmune diseases. Let's start with the basics. One of the most important things that happens at EULAR is education. Thousands of rheumatologists from around the world gather to hear the latest research and clinical updates, and medicine changes very quickly, as we all know. New drugs emerge, new safety information develops, researchers discover new ways to diagnose and treat disease. For practicing doctors, conferences are often one of the fastest ways to stay current. And this matters directly to patients, because the doctor sitting in front of you next month may change how they approach treatment based on something they learned this week at EULAR. That can mean earlier diagnoses, better disease management, more individualized treatment approaches, or awareness of therapies that were not available even a few days ago. These conferences help bridge the gap between research and real-world patient care. Another critical part of conferences like EULAR is collaboration. Researchers do not work in isolation. At meetings like this, scientists present data directly to clinicians who treat patients every day, and those conversations matter enormously. Researchers may develop promising therapies in controlled clinical trials, but practicing doctors ask practical questions. How will this work in the real world? What about older adults? What about patients with multiple chronic conditions? What about quality of life and long-term safety? That exchange improves the science itself, and importantly, it helps move innovation closer to the realities patients actually face every day. Now let's talk about where organizations like GHLF fit into all of this. Years ago, many medical conferences were almost entirely focused on researchers, physicians, and the industry. That has changed dramatically. Today, patient organizations are increasingly recognized as essential partners in healthcare discussions because patients bring something no lab test or academic paper can fully capture: lived experience. At GHLF, part of our role is connecting scientific progress with real-world patient outcomes. That means talking about access barriers, insurance challenges, medication affordability, fatigue, mental health, daily functioning, quality of life. A treatment can look impressive on paper, but if patients cannot access it, tolerate it, afford it, or meaningfully benefit from it in their daily lives, then the story is not complete. Patient advocacy organizations help keep the healthcare system grounded in real life. Now let's talk about one of the most exciting areas that researchers are discussing at EULAR this year. Many listeners have heard of CAR T in the cancer world. These are advanced therapies where immune cells are engineered or modified to target disease in very precise ways: lupus, rheumatoid arthritis, Sjogren's disease, and systemic sclerosis. This is one of the biggest conceptual shifts happening in rheumatology right now. For decades, treatment has largely focused on suppressing the immune system continuously over time. But researchers are increasingly asking, could we someday fundamentally reprogram the immune system itself? Now, a very important caveat here. These therapies are still early on. They are complex, they are very expensive right now, and they are certainly not around the corner for most patients. But the excitement in the research community is real. I'm meeting with some of these doctors, some of these scientists, and I could feel the excitement. And one of the valuable things about conferences like EULAR is getting an early sense of where medicine may be heading over the next decade. So stay tuned to see what more is coming in the world of CAR T. Another major theme at EULAR this year is artificial intelligence and digital health. AI is now showing up across almost every part of rheumatology research, including imaging analysis, predicting disease flares, identifying patterns in large data sets, remote monitoring of patients, and personalized treatment selection. Now, whenever people hear AI, there's often a tendency to jump immediately to extremes. Either AI will solve everything or AI is going to replace everything. Neither is realistic. The more practical reality is that AI may increasingly become a tool that helps clinicians make better, faster, and more personalized decisions for patients. For example, AI may eventually help identify which patients are most likely to respond to certain therapies or which patients may be at higher risk for complications. That can improve care dramatically. But there are also important questions, such as data privacy, bias in algorithms, and access to technology. Technology is there to support rather than replace human relationships in the healthcare world. So this is an area with enormous promise, but also important caution. If you want help staying informed about the latest advances in rheumatology and chronic disease care, visit GHLF.org and sign up for our free newsletter. We translate complicated medical and policy developments into plain language so patients and caregivers can stay informed without needing a medical degree. That's what we're here for. Back to the show. One of the most encouraging trends in rheumatology is how much more attention researchers are paying to patient-reported outcomes. Not just inflammation scores, imaging, lab results, but also fatigue, pain, work limitations, emotional health, ability to function day to day. That shift did not happen by accident. It happened because patient organizations and advocates pushed the field to recognize that managing disease is not just about controlling lab values. It's about helping people live fuller, healthier lives. And increasingly, researchers are listening. So if you're listening and wondering, why should I care about a healthcare conference happening in London? Here's why. Because these meetings help shape the future of care. They influence what our doctors learn, what treatments move forward, what researchers prioritize, and how patient experiences are incorporated into medicine. And while patients may not be physically in every room, organizations like GHLF work hard to make sure patient voices are represented. At its best, medicine is collaborative. Researchers, clinicians, patient advocates, and patients themselves all bring different perspectives, and conferences like EULAR create a space where those perspectives can come together. That does not mean every exciting study becomes a breakthrough overnight, but it does mean progress happens faster when people share ideas, challenge assumptions, and keep patients at the center of the conversation. Over the next few days, I'll continue listening, learning, and bringing back the most important themes and developments to our community, because scientific progress only matters if it ultimately improves people's lives. Thanks for listening to The Health Advocates. If this episode helped you understand why conferences like EULAR matter, share it with someone who may not realize how much happens behind the scene in medicine and research. And don't forget to visit ghlf.org to stay informed about the latest developments in healthcare, advocacy, and research. Be sure to hit that subscribe button on YouTube, Apple Podcasts, or wherever you're listening right now. I'm Stephen Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.